Hello everyone, I'm Dr. Pavithra, fertility specialist at GarbhaGudi IVF Center, Jayanagar. Today I would like to talk to you about a very simple topic, that is menstruation. Menstruation is something which all of us need to know about, and how this affects the fertility is very important. So a normal menstrual cycle is something which is good cycle length, which comes around 21 to 35 days. And when the bleeding is moderate, that is you bleed for 3 to 5 days, not too less, not too more, and coming to no clots and too severe dysmenorrhea. So these are the things which help us differentiate from regular and normal periods to the ones which are irregular and abnormal. So when your periods are abnormal, it's trying to give us a clue that something is going abnormal in your system. Most of the patients who come to us, they come with a pre-diagnosed or a self-diagnosed reason. Like if they're having very much irregular cycles, they diagnose themselves as PCOD, but that's not the case. So we need a proper evaluation when it comes to even irregular cycles, because thinking PCOD and the reserve is actually more, it could also be as a poor ovarian reserve patient can also have these symptoms. So menstrual irregularities need to be evaluated, and certain things can even alter or even make it normal. For example, if the menstrual irregularity is because of a hormonal issue like a thyroid hormone, where hypothyroidism tends to also cause irregular periods, just a simple medication would actually solve your problem. And this again impacts your fertility, because having a regular period also means that you may at least ovulate. It's not like all patients with regular cycles are having an ovulatory cycle, but at least it gives us some amount of confidence. But when your cycles are irregular, it is definitely that you're not ovulating, or even if you are, you may not know when you're ovulating. So it is very difficult to time your intercourse. So that way, when it comes to menstruation, the symptoms are very important. So what are some of the symptoms which help us to diagnose or to differentiate between certain diseases would be that. So when you're having prolonged bleeding, or when there is long intervals, so it could be PCO, it could be hypothyroid, it could be hyperprolactinemia where your prolactin hormones are very high, or when you're having very short periods and menstruation, that is your bleeding is very much reduced and you're soaking very much less pads. So these things can predict that maybe you're having a polyp, or it could even be that your reserve is coming down. So these are the different ways which we see, but the definitive way would be to get a scan done, see the reserve, see whether you're in any danger line, so that you can plan for your future pregnancy or for your current pregnancy. Thank you.